Our next topic is primary dysmenorrhea. This refers to recurrent cramping lower abdominal pain. And I want you to notice it is crampy pain. It is not dull. It is not aching. It is cramping. And we'll see why that is the case in just a minute. Along with nausea, vomiting, and diarrhea, GI symptoms that occurs during menstruation in the absence of pelvic pathology. In other words, the pelvic exam is normal. What does that mean? The uterus is midline. It is freely mobile. It is non-tender. There is no adnexal masses. There is no adnexal tenderness. The uterus is not enlarged. There is no uterosacral ligament nodularity. Normal pelvic exam. It is the most common gynecologic complaint among adolescent females. So that would be a good board question. Symptoms begin several hours prior to the onset of menses and continue for 1 to 3 days, as long as the menstrual period is on its way. Epidemiology, it does not occur until ovulatory menstrual cycles are established, and it occurs in adolescent girls around the time of puberty. The maturation of the hypothalamic pituitary ovarian axis occurs in half of teenagers within 2 years post-menarche and within 5 years by most. So these symptoms will start with the onset of ovulatory cycles within 2 to 5 years after the first menstrual period. So this is an adolescent, teenage, usually within 2 to 5 years of menses. The pathogenesis is increased production of endometrial prostaglandin F2 alpha. And what happens here is she starts ovulating. The site of ovulation becomes the corpus luteum. The corpus luteum produces progesterone. When there is no pregnancy, the corpus luteum starts to regress. Progesterone levels fall. With progesterone levels falling, we have ischemia, necrosis, we have spiral arteriolar spasm, and we have release of prostaglandins. These prostaglandins cause dysrhythmic uterine contractions, hypercontractility, increased muscle tone, so strong it leads to uterine ischemia. Uterine ischemia leads to pain. Now, the increased prostaglandins also stimulate the smooth muscle in the GI tract, so you can have nausea, vomiting, and diarrhea. So it's a cramping pain, nausea, vomiting, diarrhea with the onset of ovulatory cycles in a young woman. Management, if this is caused by prostaglandins, we want to suppress prostaglandins. So prostaglandin synthetase inhibitors, non-steroidal anti-inflammatories are your first choice. So this is medical management. You could also give continuous oral contraceptive pills, and the idea here is you don't want that fall in progesterone, which will then increase the release of prostaglandins. This is from my board review series book, and it shows how this works. We have the onset of ovulatory cycles. The corpus luteum produces progesterone. No pregnancy occurs, and so beta-HCG does not signal to continue the continuation of the corpus luteum. The corpus luteum starts to regress. Progesterone levels start to fall. When progesterone levels fall, spiral arteriolar spasm, and we have release of prostaglandins. Those prostaglandins cause myometrial contractions so strong, you have ischemia. Ischemia causes pain. If you have pain in the heart from ischemia, we call that a heart attack. Would it not be reasonable then to call this a uterine attack? Ischemia of the uterus. Now, studies have been done looking at the tension in the wall of the uterus by putting balloon catheters into the uterine cavity. Now, good quality labor contractions are about 50 millimeters of mercury. strong. They have measured in these young women contractions of the uterus, 150 millimeters of mercury. This woman is in labor for days. No wonder she is unable to function. Primary dysmenorrhea. What this looks at is when you use nonsteroidal anti-inflammatories, in this case it was meclofenamate, what is the difference between placebo group and the treatment group in terms of pain and in terms of the uterine contractions? And you can see, by giving the nonsteroidal anti-inflammatories, you can reduce the symptoms by 75, almost 80%. Now, they won't go away entirely, but significant improvement. Primary dysmenorrhea. Okay, and that's the end of that topic.